You are listening to Society Bites Radio, social interaction for the mind and soul. Thanks for joining us. I'm your host, Naomi Slater, and you have tuned in to Divine Couples, adding intimacy, passion, and healing to your lives. Orly Gueron is a psychotherapist and licensed marriage and family therapist. She has been in private practice in Miami for over 12 years. Orly earned her master's degree in marriage and family therapy from the University of Miami. Orly has also completed Level 2 training certification in the Gottman Institute. She is happily married and has 2 teenage children. Orly also speaks Hebrew fluently, which allows her to treat many couples whose first language is Hebrew. She has much experience working with couples who struggle with various relationship issues, including sex and intimacy, trust, and trauma. So great to have you with me, Orly.
It's great to be here, Naomi. Thank you for having me.
Of course, it's a pleasure. So you come from a background in psychotherapy. Can you tell us what are some of the main tools you use when treating couples?
Sure, Naomi. So, as a couples therapist, one of the most important tasks is to remain neutral and not to take sides. So this is a little different than the work we do with one-on-one clients, because in this case, I always make sure that my couples are aware that my client is their relationship. And the most important tool that I use in therapy is rapport building. It is my job to build trust with both partners and help both of them feel validated and heard. And yeah. So, it's a very challenging task because you kind of have to always, make sure that they both feel you are there for both of them, and not just one of them. I also use interventions that are adapted from the Gottman Institute. As you mentioned, my certification. I love using some interventions from the emotion-focused couples therapy, which is another extremely helpful theory that I base many of my work with couples. But I truly believe that helping couples connect with their feelings and attachment injuries can help them repair their relationship issues, their adult-like relationship issues, because everybody brings into the relationship baggage, as we call it. So I always like to know, what do you bring to the relationship from your past, from previous relationships?
I think that's so important that you're able to create that trust with both partners. I know that that's super important. Really help any couple heal their relationship. So that's really wonderful. So when you treat couples, do you find that there are gender differences in perceptions of sex and sexual desire?
Oh, I do. Although I don't like to generalize, as there are always exceptions. Throughout the years, I have noticed that there is a pattern in the way the two genders perceive the role of sex and sexual desire. And I would like to emphasize that this is more true with heterosexual relationships. It's very important to distinguish, because it is generally different with same gender couples, which I also see, and the patterns are somewhat different in these cases. So as to the differences among men, sex is much more physiologically based. Men see sex as a way to connect, and their sexual desire is more physiological. And often their on and off switch, as I like to call it, is based on a physiological need. Men's sexual desire is not based as much on whether they are less connected emotionally or more connected emotionally. Now, with women, it is in general, again, in women, there is a different, their on and on switch it, operates differently. They often need to feel emotionally connected to have an increased desire. There's that joke that actually that has been circulating around lately with the COVID quarantine, that if you want your wife to want to have sex with you, just wash the dishes. So, but
Yeah.
there's so much truth behind it,
Yes.
because as simplified as it sounds,
It
this
connects to her emotionally. She's getting her
exactly
emotional needs met in some
right.
way.
Right. She feels important. She feels loved. She feels my partner thinks about my needs, about me.
Mhm.
So that creates that closeness and increased desire. Um, so women in general often perceive sex as a byproduct of their feelings, that sense of intimacy with men. Um, they believe, whereas men believe that sex will lead to intimacy. At the end of the day, both genders are right.
Yeah.
because sex and intimacy are it's a cycle. It's not linear. One does not lead to the other. It's a cycle. It's a dance that the couple dances.
Yeah, that's very perceptive. And do you sometimes find that it's the opposite? That sometimes the man has more of an emotional need, and the woman can kind of be a bit more physiological about her urge for sex?
So, as I mentioned, there are always exceptions. I have seen
Yeah,
that,
yeah,
but I have to say it's more often
yeah,
the other way around.
yeah, yeah. So, can you also talk about sex and intimacy in long-term relationships? Any misconceptions and challenges that you may see there?
Sure. So, Naomi, as we understand that there are definitely different perceptions about the role of sex between genders, this often is the biggest challenge in couples counseling. This issue is actually the cycle that many couples find themselves stuck in. The challenge is to help both sides to understand that they both are able to break the cycle together. Closeness leads to healthier sexual relationship, and more sex leads to closeness and connection.
Hmm.
So this is actually a huge challenge, because when they come to counseling, they each believe that they're right, that there is only one way.
Right.
So my role is to help them understand you both are right. There's no right or wrong. Another misconception is that women always have a lower libido. Many people believe
Mm,
that they suffer from a lower libido, lower testosterone levels, which is very often the case, but it's not necessarily connected to lower libido. That is many times the case, as I said, but many long-term couples at times believe that sex is not something important. After years of marriage, they almost come to terms with it. They almost say, "Oh, but we've been married for 10 years, so it makes sense that it's part of being married for so long." Um,
yeah. Yeah, I see
and
that a lot too. Doesn't have to
right.
be that way, of course.
Right. So and the problem is that they don't realize that it affects their sense of closeness and connection, because,
Yes.
and it affects their marital happiness. So it's my job actually to help them reawaken their sexual relationships in order to help with closeness and intimacy. Um, Another challenge that I often see with regards to desire is actually, we can call it a paradox. A long, loving relationship really enjoys knowing everything about you. You know, in order to have a healthy, long term relationship, we want to know everything about our partner. We want to be able to
Mm-hmm.
trust our partner. But yet, the paradox is that desire needs mystery. And desire,
Yes, this is a paradox.
it is a paradox. So, you
Mm-hmm.
know, this is a conflict that often presents itself in long term relationships. The more you know about your partner, the more you feel trusting, safe, loved. Yet your sexual desire has a lot to do with fantasy and the unknown about your sexual partner. So how do you work with both? That is a big
Mm-hmm.
challenge.
Absolutely. Yes. How do you maintain that mystery
Right, right. In
when you're
long-term
sleeping in the
relationships.
same bed with somebody every night? Yeah, that is a challenge. Absolutely. So,
Right.
we've been talking about sex, 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 but I'm curious as to how much is sex really a main issue when you treat couples? What percentage of the treatment is related to sexuality?
So, if we want to call it a presenting problem, because we all, as therapists, we always look for the presenting problem when I see couples. So, surprisingly, many couples actually present, or their presenting problem have a very little to do with sex and intimacy initially. And I'm
Mm-hmm.
emphasizing initially.
Right.
um, Most of the time, couples to decide to try couples counseling when they struggle with issues related to communication, intimacy in general, but not necessarily sex, finances, inability to resolve conflicts, trust and betrayal. So, but
Mm.
as you dig a little deeper and over time, you realize that sex is an issue that you
Mm-hmm.
have to address. Sex and intimacy are issues that you have to address in order to make some progress and see improvement in their relationship.
Would you say that's oftentimes the underlying issue for the presenting problem?
Sometimes, sometimes it's in an underlying issue. Sometimes it becomes the big elephant in the room.
Yeah.
They
Yeah.
don't really feel comfortable talking about it. Sometimes they feel embarrassed, of course. Sometimes they feel guilty that this is something that they are even concerned about,
Mm-hmm.
as
Mm-hmm.
if, as we said earlier, they don't think that sex, should be an important issue, and after they are married for 20 something years, so they don't necessarily, place such emphasis on it. But then they realize, oh, this is an important thing. We want
That's so
for our
interesting.
happiness.
It's as if they're kind of negating their own need for pleasure. It's like they don't deserve pleasure after they've been married for 10, 15, 20 years. That's such an
Exactly.
interesting perception. And it really
Mhm.
actually leads me into my next question, Orly, which is how does stress and anxiety affect sexual desire? So that I'm sure connects to pleasure, of course. When you're stressed and
Right.
anxious,
Right.
how does that affect?
Right. So, well, generally, stress and anxiety can significantly reduce sexual desire. Um, but when it comes to gender differences, I also see a different response to stress and anxiety when it comes to stress